My name is Narges Qayyum. I'm trauma and emergency physician and I'm also working as a volunteer with MDI. MDI is spreading breast cancer awareness through series of videos in the month of October. My colleagues have already discussed different aspects of breast cancer, including signs and symptoms, different diagnostic modalities and treatment. Well, I'm here today to discuss about how to prevent breast cancer. There is no short way to prevent breast cancer. However, there are different steps that can be taken to reduce the risk associated with breast cancer. This brings us to our first question, which is what are those steps that will reduce the risk associated with breast cancer? Lifestyle modifications play a very important role in preventing or reducing the risk associated with breast cancer. Coming to our first step, which is limiting alcohol. The higher consumption of alcohol will eventually increase the risk of breast cancer. Based on the research of effect of alcohol on breast cancer, it has been shown that even minimal amount of alcohol is not safe. Our next step is maintaining healthy weight. If your weight falls in the healthy range, try your best to maintain that weight. But if your weight is outside of this healthy range, you can consult your physician and they can advise you how to reduce the weight in a healthy manner by increasing the amount of exercise and reducing the calories intake per day. This brings us to our next step, which is being physically active. Well, everyone knows being physically active will eventually reduce the weight and will decrease the risk related to breast cancer. It is always advisable for healthy adults to do almost 150 minutes of moderate aerobic exercise per week or almost 75 minutes of vigorous aerobic activity per week, including strengthening exercises almost twice per week. Our next step is about breastfeeding. Different studies have shown that breastfeeding eventually will reduce or prevent you from getting breast cancer. Our next step is about limiting hormonal therapy in postmenopausal signs and symptoms. Well, combined hormonal therapy does increase your risk of breast cancer. So whenever you are going to start or have plans of starting hormonal therapy, always discuss the risk and the benefit associated with hormonal therapies. Your postmenopausal symptoms might be reduced by non-hormonal medications or therapies. But if really required, you can use low dose hormonal therapies under the supervision of the physician for a limited time period. Well, our next question is about, is there any healthy diet that prevent breast cancer? Well, different studies have shown that Mediterranean diet supplemented with extra virgin olive oil along with mixed nuts does have effect on reducing the risk of breast cancer. Mediterranean diet mainly focus on plant-based foods such as fruits, vegetables, legumes, whole grains and nuts. My next point of discussion is about those females who are having increased risk of breast cancer. I'm talking about those females who have a very strong family history of breast cancer or they have a gene mutation which can increase them for having a breast cancer. So for those females, it's always advisable to do genetic counseling and testing to assess their breast cancer risk, and also do a close observation for early signs of any breast cancer. Frequent visit to your physician every 6 months to 12 months, and in some patients we have to do early diagnostic studies like mammograms. And depending upon your genetic testing, in some of the patients we might have to start you on medications that will reduce your risk of getting that breast cancer, and in some of the patients eventually we have to do the prophylactic mastectomy, which is removal of the breast tissue to reduce your risk for getting the breast cancer. Please be mindful that this can only be done after your proper full history taking, assessment and diagnostic studies. This brings us to our last question, which is what else I can do? Please be vigilant. Do self-examination. Make sure if you find any skin changes, any lumps and bumps, any discharge, meet your physician and discuss with them, because we strongly believe prevention is better than cure. Thank you so much.